Join us now for Health for Life, brought to you by Hamilton Healthcare System. I am here today with Brooke Green of Hamilton Diabetes and Endocrinology Center. Brooke is a nurse practitioner at Hamilton Diabetes and Endocrinology Center. Brooke, it's great to have you back on the show. I want to talk about SCAD today. Now, we talked on a previous program about SCAD, but we didn't really get into detail about it. And we were talking, and for those that did not hear the last episode when we talked about SCAD, I want to talk about your personal situation. I understand that you had a heart attack, and tell us about what happened, and tell us about how SCAD is involved in that. I've never heard of SCAD.
Yeah, most people have never heard of SCAD. And
SCAD.
SCAD, and it stands for Spontaneous Coronary Artery Dissection.
Dissection. And that makes me think something is tearing or ripping.
It is, and that's exactly what happens. The blood vessel, the artery actually will tear.
Tell me about you, how you found out you had SCAD, and about the heart attack.
Yes, this was 10 years ago,
Okay.
March, just like you, Bobby, you remember your date. I can remember it very well, March the 23rd,
Gotcha.
2013.
Because mine was in December.
December
27th.
So that's a date we'll never forget.
Yep.
But yes, I did experience chest pain, shortness of breath. My left arm went completely numb, and I had a feeling of impending doom, that something bad was happening.
Wrong,
Right,
yes.
right. And I was driving at the time. I was only a mile away from home. I went ahead and made it home. When I got there, I did have my 13-year-old daughter with me. I did call 911, and they did come out. Firefighter came out. We determined partially my help as well, because I was stating I should not be having a heart attack. I'm 42 years old. I have no risk factors.
Right.
So he in turn agreed and said it's
Okay.
probably anxiety. So
Yes.
we were both in agreement.
Yes. But anxiety, I mean, that's some of the symptoms of anxiety.
It is.
Yeah.
It is. And I already had a history of acid reflux, so I thought maybe I'm having just a bad episode of heartburn. So anyway, the symptoms did subside somewhat, but this was on a Saturday, and I continued to have symptoms throughout the weekend. My husband was really wanting me to go to the emergency room. I refused, did not feel well. That following Monday, I did go to work, was feeling worse. I called a friend of mine who is a nurse practitioner at a cardiologist office. She was able to work me in, did have an abnormal EKG, went for a stress test. That was abnormal, and then eventually went for a cath, a cardiac cath, and we did determine at that time I did have a heart attack, and the heart attack was not the standard buildup of plaque like you would see with what we call a regular heart attack.
I understand.
This happened due to a tear and actually two of my distal arteries. So it did not occur in the main artery, what we call the LAD or the widowmaker,
Right.
fortunately, but that is actually the most common area where a SCAD occurs.
Wow.
So I was very fortunate with that not occurring. But due to having a heart attack, of course, is ischemia of certain areas of the heart. So I did have damage. But prior to that, I had been having symptoms. Had been having in 2012 shortness of breath, which was huge. And that was probably my biggest complaint, stating I can't breathe. And I even thought maybe I have asthma, something's going on. And then it progressing to extreme fatigue, exercise intolerance. I was active, a runner. I ran with a group several days during the week, couldn't keep up with them. So there was a lot of changes.
A lot of symptoms.
A lot of symptoms that just, to me, did not stand out as heart disease until that day. And even with that day that it happened, I was just in unbelief. I just was not accepting that, hey, okay, something is wrong, but still it did not make sense to me.
So you go to work Monday, talk to the cardiologist,
Right.
Nurse at the cardiologist?
Yes, it was the nurse practitioner.
Okay, so what happened then?
So we had a very similar conversation. She was like, well, your EKG is abnormal. But I said, but it doesn't make sense. I should not be having a heart attack.
Yeah.
I said, just think about it. I'm trying to convince her too. Well, I've never had hypertension. I've never had high cholesterol levels. How could this possibly happen?
Right.
And so, but with it being abnormal, the EKG, we did move forward the next day and we completed a stress test. And I received a call that evening actually from my cardiologist who stated that, yes, in fact, we need to get you in here. Your stress test was positive.
Ooh.
So the very next day, they went ahead and admitted me to the hospital.
Hamilton Medical Center in Dalton, yes.
And they went ahead and did a cath. So with SCAD, it is treated differently.
Now, how would you treat SCAD?
Yeah, and that's a good question. How are you going to treat a tear that's inside the artery?
A stent is totally different.
Right, it is.
With no need for a stent. But how would you treat a tear?
With the tear, it is different. And I could remember my cardiologist telling me at the time that it was different. It was not the typical plaque. So at that time, he did consult with an interventionalist. They decided, no, a stent would not be appropriate. It could actually cause more damage.
Right.
So at the time, I was actually sent to Emory for a second opinion, but that's how unknown it was at that time. They still...
Yeah, we're talking over 10 years ago.
Right,
yes.
right. I still was not diagnosed specifically as SCAD at that point in time. I did my own research over the years because I still had chest pain. I had chronic angina. None of it made sense to me, Bobby, at all. Yeah. So I did my own research. I found out that Mayo, they were doing research on this unknown disease that I had never heard of, SCAD. And I was just reading about it one day, just came across that it occurred more often in women who were peak age or median age was 42 years of age. And it was, it happened or occurred in individuals that were healthy. Anyway, I found out about the Mayo Clinic and I submitted all my records. And so they evaluated my records and based on the cath that was done in 2013, did determine it was a SCAD event.
Well, now, where do you go from there when it comes to treatment?
With treatment, right now, based on current research, taking an aspirin every day, 81 milligram baby aspirin.
Yeah.
I do that. Being on a beta blocker just to decrease the workload of your heart, particularly if you have hypertension.
But did they not go in there and sew that up or whatever?
No, and that's a good question.
How would they fix a tear? Aren't you leaking blood?
It actually will heal itself, Bobby.
Okay.
And it could take several weeks for that to happen.
Several weeks
for that to happen. So what's important when somebody is immediately post-SCAD, it is important for them to actually be in the hospital it's recommended right now based on Mayo Clinic guidelines, 4 to 5 days for continuous monitoring.
Right.
Because the risk of a reoccurring event is high within the first 10 days. So remain in the hospital for observation. Also, anti-platelet therapy. Because this is a tear, and we believe that several different factors can cause a SCAD event. They're looking at hormones in women. Stress can be a big factor. High blood pressure. Now, I did not have high blood pressure going into this, but high blood pressure can actually be a risk for this too because it causes pressure on those blood vessels.
Got you.
So it's important after you've been diagnosed with SCAD to keep your blood pressure controlled. And since then, I actually have been diagnosed with hypertension. So I do have high blood pressure.
Goodness.
So I really pay attention to that, watch my sodium intake, eat healthy. So basically, the treatment ongoing is lifestyle changes. I continue to exercise. Also, the pressure in the vessels, they do believe that excess pressure can cause a tear inside that artery. So they do not recommend heavy weightlifting. They recommend exercise, but I usually do not lift anything over 20 pounds.
Got you.
And there are certain individuals that have connective tissue disorders that may be at risk, such as fibromuscular dysplasia, which is actually a rare condition, but it's basically weakening of the blood vessels. And 80% of people that have a SCAD event have this condition.
Really?
Yes.
8 out of 10.
Mm-hmm.
Wow.
That's correct. So post-SCAD, it's important to be assessed for FMD. The results with me, they were inconclusive. There are a few cardiologists that, since there's an 80% risk, will go ahead and say, okay, this person has had a SCAD event. Let's assume they have FMD. There's not any cure for that, but it's basically observation, paying attention to your body, because any of the tears can happen anywhere throughout your body.
Yes.
The carotid arteries, the renal arteries can increase the risk of having a stroke. So if anyone has any symptoms of a heart attack, any symptoms of stroke, it's important to call 911 immediately.
Yeah, call 911. And in your case, I mean, you weren't overweight.
No.
You exercised every day.
Exactly.
You're 42 years old.
Right.
And it still happened to you.
Yes. And you can.
And it can happen to anyone.
It can happen to anyone. And for anyone that's had a SCAD event, there's a 30% risk that it could happen again. So that's why it's really important to keep yourself.
And it happens more often to women?
It happens more often to women. It can happen with men, but there's a higher percentage of women that are affected. And we have said in the past with SCAD that it's very rare, but I believe it's been misdiagnosed. It's not as rare as we really think that it is. So if anyone's out there and they have had the symptoms that I have discussed, it is so important to get with your provider.
Yeah, I'm sure that it is. Well, Brooke, thank you for joining us today.
Thank you.
It's always good to have you on the show.
Thank you, Bobby.
I appreciate that. For more information on Hamilton Healthcare System's heart care services, visit hamiltonhealth.com/heart. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.